Hey guys, my name's Sam and welcome to Prep Medic. I get a ton of questions about off-the-shelf first aid kits from stores such as REI. So today, I've got two such first aid kits that we're gonna be going through, and we're gonna discuss the difference between these off-the-shelf first aid kits as opposed to traditional military IFAKs. So I literally just walked into REI and picked up both of these kits. These were kind of front and center, which is why I picked them. And it's also a pretty commonly known company, Adventure Medical Kits. So today we're gonna open up both of these, just go through the contents. I'm gonna discuss what's good, what's bad, and what I would add for any kind of backcountry adventure, or what I would add in any situation where you'd be stashing one of these kits. So let's start with this guy right here. I've got no relationship to this company. I literally bought these off the shelf. So the bags themselves are obviously pretty cheap, but these aren't meant to be like mollied to the outside of a plate carrier. These are meant to be thrown in a backpack for a specific trip. Cost on both of these is sub $50, so they're really not that expensive. You've got some booklets out here that tell you what's in it, and they both encourage you to open the kit and get familiar with it. Also get first aid training, and it's got this little lock here that we're gonna take off. So let's take a look at what's inside this particular one. So coming in here, you've got a pretty well organized kit, and it kind of folds out in this tri-fold design, which is kind of cool. Let's go to like the life-saving things first, or what they claim are life-saving, and that's in here. This is the Stop Bleeding Fast kit. Now in here, you've got it subdivided into a couple different compartments. So first and foremost, we have this stuff. This is their bleeding control section. And in here, what they've determined is good for your bleeding control is a abdominal gauze pad. So let's open this guy up and I'll show you what this is. I believe this is it's a 5 by 9 inch pad, and it's got a radio opaque line. So if this is shoved into a wound, a surgeon can see it. And then you have some gloves right next to it. So these are for your own protection. So this right here is the difference between this kit and a lot of military IFAKs. Most of the stuff in this kit is going to be focused on quality of life, not necessarily actually saving your life. So while this pad is going to help cover up a laceration, keep infection from getting in, etc., this is probably not going to stop life-threatening hemorrhage. It's going to cover up a wound and make it a little bit prettier and potentially avoid some future pain. But this is not a life-saving intervention right here. Keep that in mind when you're buying one of these kits. I would recommend supplementing this with possibly a tourniquet, or at the very least, a little bit of packing gauze or quick clot, so you can stop life-threatening bleeding if you do get in that situation. Now, a lot of people will say, well, hey, what's the chance of me getting life-threatening bleeding in the backwoods? And I'd say most commonly what we see is we're gonna see knife wounds. Most people are taking a pocket knife with them, backpacking, and they could be whittling a stick or trying to fix something and they accidentally stab themselves. You also have the potential for animal attacks. Out here in Colorado, we've got mountain lions, which are a pretty big deal, and even like your snake bites, if you have a rattlesnake around, they can actually puncture an artery and cause severe bleeding. Both are reasons to carry a little bit more than is in this kit. All right, coming into the back of this kit just a little bit more, we've got a guide to wilderness medicine. And this has a lot of different stuff in it. Looks like it's got ABCs of wilderness response, abdominal injuries, bleeding, blisters, broken ribs, burns, chest injuries, choking, CPR. A huge list of things. Now, I will tell you, this is pretty wordy. So in some of these like super acute situations, you need to be trained in it. This will help you like wrap a splint, treat a bug bite or something. But if somebody's like dying in front of you, it's going to be kind of hard to open this book and find what you need. That being said, it's better to have a reference book than none at all. So that just fits right behind all of that. And it looks like there are a pair of small trauma shears. Trauma shears are great. It'll help you get at any kind of major wound or issue. It's even just a handy tool to have around camp. I will say you do want to be careful cutting things, especially in a wilderness situation, because you could be, cutting off all your buddy's clothes, and now you're out for next 2 nights, and you just cut his down vest or whatever it is, and they're not going to be as warm. As we know, hypothermia is super important. So trauma shears are good. Just know that you're really going to want to try to take them off instead of cutting them if it's not an immediately life-threatening issue. And then let's see, what else do we have in here? Got a couple different things. We got some safety pins, tons of uses for safety pins. I know people say like don't pop blisters and stuff like that. I pop my blisters, so I use one of these. You know, can be used to relieve some pressure behind your nail if you jam your thumb, something like that. These even can be used to like dig out a stinger or a splinter if you absolutely have to. And then they can be used to, you know, secure any kind of wrap. They can be used to fix some tools. So safety pins are great. And then last but not least, we have this tool right here, which is a set of tweezers, if I can get them out. Set of tweezers, and then they also say this is like a tick remover as well. So you want to be careful removing ticks. Make sure you get the head as well, and then this will also help you remove stingers. People also say, hey, don't use tweezers to remove stingers. Use a credit card because you'll squeeze more venom into them. I'll be honest, I just pick the stingers out with tweezers, but the official recommendations are not to do that. So there's just some extra instruments right in there, and that looks like all that is in that pocket. Now, next up, we've got cuts and scrapes. So this is your, you know, minor wound care. So this is another point I want to make about these kits. A Band-Aid, you know, some little bit of ointment for it is probably not going to save your life at any time. This is stuff that if you get a scrape or a blister or something's hurting you, you can put this on and it will help salvage your trip. It will make you happier for a extended period of time. You know, it's nice to have the Band-Aid on that cut, you know, while you're hiking just to keep it clean and to keep the pain levels down so it's not rubbing on stuff. This is not going to save your life. So important to have, but it's not really the thing that's going to get you out of the woods. It's just going to keep your trip going a little bit better. So let's see. In here, we've got a number of things. We've got some antiseptic towelettes, keep things clean. I will say if you're out for a truly extended period of time and you're out in the backwoods, having some way to kind of help clean wounds is super important, and clean your hands, hygiene, you know, that might keep you from being infected, which could in the long run save your life, although I don't think this is going to, you know, make the difference between life or death, kind of like we were talking about. You've got some alcohol swabs right here. And let's see, we've got steri strips. So steri strips are essentially a stand-in for stitches. You put one on either side of the wound, you can pull them tight, they just pull things closer together. Once again, not life-saving, but it can keep you from getting a pretty horrendous scar if you can start the healing process with it closed, as opposed to healing open. This also reduces chances of infection. And then you have a bunch of different Band-Aids in here. So you've got knuckle Band-Aids, here, knee Band-Aids, and then you've got some normal stuff. So if you got a little boo-boo, you can throw this on it. Now, in like my SWAT kits that I do and that I use, I always keep like a boo-boo component, because a lot of times you're dealing with this kind of thing. It's not the life-threatening situation. So you do want to make sure you are playing the numbers and you're keeping supplies for the more common issues you're going to face, which is why these are important. All right, so next up, and kind of in the same lines, we've got wound care, burns, and blisters. All right, got a lot of stuff up here, which is kind of cool, on some things that aren't always thought about. So let's get all this out. Like I said, I haven't gone through this. I haven't even read what everything in here is. So, you know, we're learning together today. So up here, we've got a thing of acrylics, or I don't know, you can call this any kind of thing. What is this? Duncan, I guess. And this is just a wrap. So that bleeding pad I showed you earlier, if you're wrapping this around a sizable laceration, you know, you can turn this into a pressure bandage. And honestly, this is going to work just as well as, you know, Israeli or a NAR emergency trauma dressing. It's just in two pieces instead of one, so a little less ergonomic. And these are both in two different places on the kit. Tension with this, you just put it on the wound and you hold pressure and then you dig out something else. A little less convenient if you're a solo hiker, however. Right here, you've got a thing of rolling gauze, so this is really basic, and you could use this for wound packing. It's a little bit light and loose, but once again, this is for wrapping that wound. You could wrap a splint in place. You could pack a wound if you absolutely had to, but it's not a ton of gauze compared to like a quick lock gauze or something like that. So good to have. And then we've got a lot of these other trauma pads. So they're similar to this, except they're different sizes. So these guys right here are 2x2s, and this one here is 4x4. So same thing, just a different form factor, a little less big. And then tape. Tape is super important. We use it to, you know, secure gauze like this. You know, you can use it as a pressure wrap. You don't necessarily have to do it like this. You can use it to fix tools, secure splints. You can do self-splinting if you break your finger or your toe. If you're backpacking, you break your toe, like that could be pretty detrimental, and you do need to be able to get back out of the woods on your own. So having something like this is super cool. And then right here, we've got like a flush. So this would be for irrigating a wound. It's got this little tip on here that will give it just a little bit more pressure and let you kind of target certain areas. So washing out a wound, you could use this as an eye rinse if you have some water. Just, you know, keep in mind, like, you're not just pulling water out of a stream or something. You're going to want to do this with filtered water, or sterile water is your best option. You can always boil something if you absolutely have to. We don't want to be introducing more infections into the wound. So super cool. You got that in there. You've got Q-tips, which can be used to apply medications. Beyond that, I don't really know. I don't have too many uses for these in a backpacking situation. At least, I guess you could use it to clean out your ear, maybe, but I really wouldn't do much with that. So these, I really don't think they're that necessary in there. And we got a couple other things. So once again, this is another pressure dressing here. And then here, we've got a thing of moleskin. So this is pretty lightweight moleskin, and this is used to treat blisters. If you're getting a hot spot, you can take one of these, cut out the size you want with those trauma shears, and throw it over that hot spot. You can cut like a donut, layer it up a couple different ways, and it's just gonna keep your feet from getting absolutely chewed up. Once again, not gonna save your life, but it is going to make your life a lot better if you're doing a couple day backpacking trip. Now looking at this, it looks like there's some pre-made shapes in it that you can just pull out, and they're gonna give you exactly what you need. So like, here's the donut I was talking about. There's different schools of thought in treating a blister. I personally usually just take moleskin and throw it over the entire blister and call it good. But like here, you could put it around the blister. It protects the skin around it from moving, and you can build these layers up a little bit. It's going to work for your blister as well. So a bunch of different things you can do with moleskin. This stuff has saved my life on a number of trail runs and backpacking trips. So always good to have it. I will say this is a little thin. A lot of the moleskin I use is a little bit thicker, so you know, it's kind of a personal preference thing, and once you've used it a couple times, you'll figure out what you kind of want from it. All right, last but not least, in this kit, we've got medications. Now, medications are something that are like never carried in like a traditional military IFAC, like we were talking about, that deals with life-saving, not life betterment. But backpacking and being in the wilderness, that can mean some different things. So let's see. In here, we've got ibuprofen. Super great. It's an anti-inflammatory. You know, a lot of schools of thought now are showing that anti-inflammatories actually reduce the healing process. So, you know, inflammation is used by your body to get nutrients and healing products to whatever wound you have, whether that's, you know, a sprain or, you know, that's a bug bite. It's using inflammation to help heal you. So taking an anti-inflammatory can inhibit that healing process slightly. Now, this does reduce pain. It reduces your fever. It is good to use. Just understand what it does. The other thing to keep in mind with ibuprofen, it can increase bleeding slightly. So like, you know, in a SWAT medic role, we try not to give people ibuprofen because if there is, you know, a traumatic situation later, this can make it just a little bit worse. Is it like, is this like warfarin? Is it going to make them bleed out way, way faster? No, but it is something that's, you're definitely not aiding in the process. So keep that in mind. And then right here, we've got acetaminophen. So this is essentially Tylenol. Tylenol basically interferes with your perception of pain. So it's not doing anything physically to reduce the pain, it's just making you not perceive it as much. So Tylenol is great in a lot of these situations. You can double up Tylenol and ibuprofen with each other. You just have to make sure you're separating like medication from like medication. So we don't want to take too much Tylenol in the 24 hours. Same with ibuprofen. I'll also say with ibuprofen, you definitely want to take this with some food in your stomach, or this is going to eat through your stomach lining, and it's not going to feel very good. We've got aspirin here. Now, aspirin is super effective with somebody that's having a myocardial infarction or a heart attack. This can help make their platelets just a little bit more slippery and keep that clot from getting any worse in a lot of different situations. Other than that, like, I don't take aspirin for pain management, even though it will work for that. and it will speed up bleeding in a traumatic situation. So understand the limitations with aspirin. All right, so this is a couple different things here. We've got Diamode. Now, Diamode might actually be life-preserving in a wilderness situation. This is an anti-diarrheal. Diarrhea, you have it a couple times, not a huge deal. You start having it a ton repeatedly in the backwoods, you're going to get dehydrated really quickly. So if you start experiencing diarrhea, you can start taking this and it might help you get out of the woods a little bit faster and not become severely dehydrated, especially in a water-limited environment. All right, and next up we have, let's see, Difen. So this is diphenhydramine, also known as Benadryl is the trade name. So Benadryl is an antihistamine, which means it just kind of helps where you have like major itching and hives, allergic reactions. There is a misnomer that Benadryl is life-saving in an anaphylactic case, so where you have like a life-threatening allergic reaction. That is not the case. It is not life-saving. This is not going to save your life. It's just going to decrease itchiness. It can also help you sleep, although you shouldn't take something like this long-term because it can cause dependence for sleep. But, you know, if you've at a really noisy campsite or something's going on and you're a little anxious, like diphenhydramine can help you sleep. All right, coming down to the other things, we have sting relief pads. I don't know. I don't throw these in any of my kits, but I suppose, you know, if you have like a bug bite or something, you could put this on. It's going to make stuff a little less painful. And then we have triple antibiotic ointment, just staving off those infections. You can put some on that Band-Aid before you put it over that cut or that blister, and it's just going to keep things from getting infected. Infections can be a big deal, but generally speaking, unless you're on a month or 2 month long backpacking trip, this isn't something that you're going to experience acutely. And lastly, we have skin prep pad. So this is just skin protection. If you're going to put adhesives over it, it makes it better to come right off. So that's everything that is in this kit. Now really quick, let's go through this other one and then we'll kind of talk about what we're missing. We kind of already touched on that a little bit. So this guy here, it's the, let's see, ultralight watertight medical kit 0.5, I guess. It's made for a group size of 1 and 1 to 2 days of support. So it's nice to see kind of what these are meant to treat. I don't think this is like waterproof if you submerge this. I'm guessing your contents are going to get wet, but most of it doesn't matter because it's all going to be in a plastic container that actually is waterproof. So I'd get familiar with your kits before you take them out there. You can open this up. This is just a like a Ziploc right up top. And this one's far less organized than this first kit here, but it was also a lot cheaper and it's a little bit smaller. So let's see, pull everything out here. I'm not gonna like really go through a lot of the repeat stuff because these are made by the same company and they're throwing in a lot of the same stuff. Here, let's see. So all came out a little bit crumpled, which isn't excellent. We've got Band-Aids right here. We talked about those, more Band-Aids. We've got some steri strips that are all crumpled up. These aren't gonna work super well if they're crumpled up there, so I don't really like how this is packaged so far. A knuckle Band-Aid. We've got these small trauma pads. These aren't life-saving. They're just gonna cover up a wound. A little bit bigger trauma pads here. Let's see here. So here we've got, I can just show you. These pads right here, this will work for like a burn dressing. You can throw this over a burn. It's not going to stick in the wound there. And then we've got all the same medications that we had in the last one, just kind of all thrown together. We also have the antiseptic towelettes, skin prep, all of that good stuff. We've got the wrap for bandaging, and then we have tape. This is a lot thinner, so it's a little less useful, but you can always double it up. It'll be just fine. The moleskin, the safety pins, and then finally your tweezers right here for removals of ticks and thorns and things like that, and your moleskin. So honestly, a little bit let down by this one. It's basically the same things except packaged much more poorly, and I think the price difference is like 10 bucks. So I guess if you are watching this to decide which one to buy, I'd go with the bigger blue one. But this is a little bit lighter weight and it comes in a waterproof container. So are these kits worth it? I would say yes. If you don't want to spend a lot of time curating it yourself, you can buy one of these kits off the shelf for $30 to $50, and it's going to work for a lot of your comfort needs. That being said, most of the medications in here you can buy in bulk and stock multiple kits. You can get moleskin pretty cheap, and a thing of tweezers. It's going to do just about the same thing as these kits, and it's going to cost you probably about half as much as this does, plus gives you the ability to refill them yourself. That being said, as somebody who is lazy myself, I like to just go into a store, have everything curated for me, and be done with it. Keep that in mind when you're looking at purchasing one of these. So we've touched on a lot of this already, but let's talk about the difference between these backpacking kits and like a traditional IFAK for the military. As you guys saw with both of these are more focused on quality of life, which can be a big deal. You know, you're in the backwoods, you've hiked for a couple days and you've got a couple more days to go. You don't want your trip to be completely derailed by, you know, a blister or by a migraine, you know, something silly like that. So these will help you keep on walking. However, very rarely do any of these store-bought kits have things that are actually going to save your life, which is where one of these IFAKs come in. So these IFAKs were traditionally used by the military for soldiers to carry. If their buddy gets shot or they get shot, they can immediately start doing first aid on them, you know, apply tourniquets, pack wounds, decompress the chest, do a chest seal over them, and really preserve their life in these hyperacute situations. I think both are super important, but you have to understand the limitations. These guys right here, these can be buried in your pack. You should have one of these on you. You don't want to be, you know, having to trudge out through completely blistered feet. So you should have something like this. But you should also take some bleeding control items. Now, you probably don't need a chest seal. You probably don't even need a tourniquet necessarily. You don't need a needle to do needle decompression. What I would say is you need some method of controlling major bleeding. So in this case, a thing of like quick clot for wound packing, I think is super important. And then if you have some space, throwing in a tourniquet would also be something that's just expedient and easy to apply in the backwoods, but you don't necessarily need the whole thing. I would bury these in your pack, and then I'd get your major bleeding supplies and I'd put them somewhere that's really easily accessible on your persons or on your pack. For me, if I've got like a waist strap on the pack, I will try to put that somewhere, like the tourniquet and the quick clot somewhere right on there, so I don't even have to take my pack and dig it out to get that stuff. So if I'm, you know, cut myself, it's right on the outside, I pull it out and use it. Just be aware, you're backpacking, you're probably in kind of austere conditions, so you don't want to have stuff wearing down in the elements. Guys, if you have any questions about this or have any questions about other kits you've seen on the market, please let me know in the comments down below, and I will see you next week.